We're not asking for anything. We're just trying to maintain our terms and conditions which we've had and enjoyed for the last 12 years with a contract with the Trust. The Trust are now ripping up that contract, which was a good contract. It delivered good care to patients, and the terms and conditions were reasonable for staff. And as I say, the Trust has now decided to rip them up and to pay us 80% less money for our antisocial shifts and double our nighttime commitment, which we believe is barbaric.
Well, it's a continuation of a lockout that started on the 26th of June. This is entering into the third week now. Members voted some time ago to take legitimate industrial action, work to rule, overtime ban. They turned up for work on the Thursday morning, the 26th, to be told they can't come to work unless they sign an agreement that says they're not willing to take part in any industrial action or not come to work, hence the lockout. And this now has been going on, say, since the 26th of June. It's a horrendous situation to be in. The Trust, trying to bully our members back to work, obviously with the full support now of the union for any financial losses, is keeping our members buoyant. It's the first time in NHS history where a lockout's taken place, and to do it now over an issue that's been running for 12 months. We asked the Trust, we want them to come back to the table to be able to negotiate. We've had two ACAS talks that hasn't produced anything at all. Very disappointing. We are willing to sit down and talk and negotiate, but the biggest fear here is patient safety as well. We're getting stories about what's happening in there, but the full picture may not come out for some weeks. We know there's delays. We know tests are being sent out. We know they've tried to use agency workers. We're concerned about patient safety and have been concerned about it all the way through. I think the Trust have tried to say that we were putting patients at risk by taking the type of action that we were, but we put it to the Trust by locking our members out and put patients at even greater risk than what they would have been had we taken the work to rule and the overtime ban. The general mood is good, and you can see this morning we've had a light-eyed sort of demonstration with the Draculas and the handcuffs. Very serious message, but it's a way of lightening it up a little bit. But you can see by the support we've got, and it's been like this every day since the beginning of the lockout, and the support that's coming in from the public and colleagues around the rest of the region and nationally has been overwhelming. And I want to place on record my sincere thanks that the support our members are getting down here.